Welcome, everyone. We're going to wait a couple seconds to allow attendees to join this webinar before we get started. Well, hello, my name is Anna, and it's my pleasure as the Assistant Director of Constituent Relations to welcome you all to this 49er Industry Chat. Before we start, we would just like to inform you that this session is being recorded, and when it's available, we'll post it on our website at csulb.edu/alumni. Once it's posted, please feel free to share this with a friend, fellow alumni, or someone that you know that would benefit from this chat. We also encourage you to utilize the Q&A or the chat box to submit questions for our guest speaker. Our alumni relations team member, Rosalinda, will be helping us moderate the chat during this webinar. I am actually now going to pass it off to an exciting guest that'll be helping me interview our 49er Industry Chat host, Christopher Contreras, who is currently a Cal State Long Beach psychology grad student. Chris, please take a moment to briefly introduce yourself.
Hi everyone, I'm Chris. I'm currently a second year graduate student in the school psychology program here at Cal State Long Beach. And I'm excited to say I'm currently wrapping up my practicum year, and I'm really looking forward to starting my full-time internship at a school district this coming year in the fall. And yeah, I'm happy to be here today with all of you. Thank you all for coming here today. And I'm also super excited to introduce our alumni host, Dr. Andrew Cleek. Welcome, Andy, and thank you so much for joining us today. I'll start off by reading your bio before we jump in. So Dr. Andrew Cleek is the Deputy Executive Director of the NYU McSilver Institute and a Research Assistant Professor at the NYU Grossman School of Medicine. At NYU, Dr. Cleek provides executive oversight for a comprehensive portfolio of technical assistance centers, which support the entire New York State mental health and substance use workforce. As a national leader in implementation science, Dr. Cleek specializes in the large-scale rollout of evidence-based practices, focusing on strategic translation of proven clinical interventions into sustainable, real-world community programs, and navigating complex healthcare payment reform. Dr. Cleek holds a PsyD degree and an MA degree in clinical psychology from Spalding University, and a BA degree in psychology from Cal State Long Beach. And so, Dr. Cleek, or Andy, thank you so much for being here with us today, and welcome.
Thank you, thank you. It's really, really, truly a pleasure to be here, and it was very exciting to be asked to come back and give a little bit back to the Cal State Long Beach community. It's really great.
Yeah, and for those of you that are watching this webinar, again, as a reminder, the alumni team will be checking the chat for any questions that come up, and we'll be happy to answer them. And so given that, we'll jump into our first question. And so Andy, can you tell me a little bit about your experiences and what led you to Cal State Long Beach? So kind of thinking about before you entered undergrad, what were you kind of doing, and how did that lead up to you being at Cal State Long Beach?
Yeah. So I grew up in Torrance, so South Bay area for life. Never thought I would end up in New York. And so I wanted to be a psychologist from when I was little. I was always that person that everybody came to with their problems and all that stuff. So I was like, all right, so this is what I'm going to do. I will use the word unremarkable student prior to college. Some people might say bad student prior to college. And I applied to Cal State Long Beach because I didn't want to go to community college and I wanted to get started and I wanted to get out of the house and I wanted to go to college. So I applied to Cal State Long Beach. I got in. My parents graciously agreed to let me go to college, even though my grades were not ideal at the time. And I got to Long Beach and really found a place that like supported me and allowed me to flourish and allowed me really to like start really taking my education seriously. And I was one, and I know a lot of, kids come to Long Beach and live at home or, still continue to live in the community. I lived on campus. I was in the dorms my first year and then lived off campus with friends after that. And I am one of those firm believers, and I learned so much. I learned a lot in the classroom, but I learned a lot more outside of the classroom, and really got started, kind of. I knew what I wanted to do when I got there, although I don't necessarily do that now, but I knew what I wanted to do when I got there. So the psychology part was easy. But the college and figuring out how to live and be a young adult, that was the part that I really had to learn. And so I learned how to be a student at Long Beach because I had never been a student before. I didn't believe in bringing my backpack home. And so I had to learn how to study and do well in class and get integrated into school. And so that's kind of how I ended up at Long Beach.
hmm Thank you for that. And it sounds like, yeah, the Cal State Long Beach was really supportive in your journey into your career. So kind of thinking more about like being on campus, were there any like involvements that kind of helped support you throughout college, such as things such as like clubs or activities, or maybe jobs that you took, or even like particular relationships with professors and opportunities there?
Yeah, so like one of the lessons learned that I would not have, I was at back of the class kid, so I did not sit in the front row of class, and I still didn't even in college sit in the front row of class. But I did build relationships with faculty members. So my undergrad research professor was just an adjunct faculty member, and my roommate and I had to do a research project. We actually went to a school and gave kids like glucose water to see if their memory improved, which I'm sure is like horribly wrong, and we probably shouldn't have done that. But somehow the school let us do it, and whatever. So we did this research project on improving memory. And she took a real interest in my roommate, who was also a psychology major, and I. And the project turned like we really got into the project and did this thing. We wrote this paper, and she enrolled us in a contest. And so we it was like us against a number of grad students, like master's theses. And so we were terrified. We had no idea what we were doing. We were 19 years old. I think we were sophomores at the time. And we had to give these presentations. And back in the day, they didn't have PowerPoint. So I'm just going to say I'm old. I'm sorry I'm old. But they didn't have PowerPoint. So you had to use these like slides that you took off this like overhead projector. And it was on this table. And the overhead was on one side of the table and the lectern was on the other side of the table. And I was 19 years old. So I was terrified. So I was shaking so bad that the lectern was shaking which shook the overhead, which means the screen in the back was shaking back and forth. And so we ended up winning this contest. But I tell that story. It's like one of my stories that I tell people when they say they're afraid of giving presentations in public. I tell that story to just say out loud, like get involved in things, say yes to things, connect with faculty members because I did that. Like that was like a big part, and I never would have thought I would have done anything with research. The other thing I did at Long Beach was I was a student peer advisor, which was basically like a faculty advisor, like to help students figure out what classes they should take, or when they were interested in going to grad school, like how to figure out how to apply for grad school. Now, why I was doing that when I was also applying for grad school, I'm not sure. But like I was that person. That was a really, really beneficial experience to me. And then I worked in the bookstore. I worked in the bookstore from the summer of my freshman year all the way until I graduated. And like I have two kids in college now, and like the advice I gave to them, and really good advice for anybody who's like in that process, is find a job where you have the flexibility to do what you need to do, and a job on campus helps with that. So it allowed me to, gave me enough money to kind of do the things I needed to do, but also like, kept me connected to the community. And I was involved in a variety of different clubs. I don't remember all of them anymore, but I think they were all important, like to not only connect to students, but to be able to connect to faculty and others on campus, I think is really, really important and was something that like definitely set me up so that when I was ready to apply for grad school, I knew who to ask for letters of recommendation. I had some experiences I could write about, which are really important. So yeah, those things were really important to me as I was doing that work.
I love that. It sounds like Cal State Long Beach was like really advantageous for you. And I loved how you said that you said yes to a lot of different opportunities, even though you kind of had some like a little bit turbulence with like the nervousness of presenting research. But still, nevertheless, I think there's really great opportunities that came from Cal State Long Beach, which was really great. And so, kind of stepping into what you do in your particular field to kind of start off with for students new to the concept, how would you define implementation science in simple terms?
Yeah, so implementation science is you mentioned that you're like looking at like evidence-based practices. So what I do is I help organizations implement evidence-based practices or implement anything. So one of the things that they don't teach you in school is it's very hard to actually get people to do stuff in the real world. So I'll use evidence-based practices as an example. So if you study behavioral health and you learn about evidence-based practices, those things are largely created by university professors with federal funding, working with people who only have one problem. So you design this thing to help kids who have attention deficit disorder or ADHD, right? No kid I've ever met, and certainly no kids you're ever going to meet working, in a school, is going to just have ADHD. They have ADHD and a bunch of other stuff. And so implementing an evidence-based practice just for kids with ADHD is actually kind of hard. And so what I do and what implementation science is really about the art of figuring out how to actually get people to do the thing that we all think is the most helpful. And so that's what that is. And that's basically what I do. And then my job beyond that is not only to figure out how to get that in one school with one clinician, but to figure out how to do that throughout a whole state. And so, how do you take these things and like actually make them go to scale and make them work with hundreds of schools or hundreds of programs around, in particular in New York, but we do some of this work in other places as well.
Mhm. Yeah, thank you so much. That's really really a great way to explain it. And yeah, there's a phrase called the research to practice gap there, where
Yeah.
there is that kind of like what's done in a lab, it doesn't always like translate best to kind of the practice of it all. And there's a lot of different variables to account for in like real life. And to kind of to speak to that a little bit, how would you balance scientific rigor with real world constraints in the community programs? For instance, kind of wanting to still stick to the practices like best practices or kind of what was created, but then kind of having to break that down a little bit to fit it into the real world. What is kind of like your overall like strategies for that, or to balance that the scientific rigor with real world constraints?
Yeah. So that's like a really, really, really good question. And there's no like one answer to that, right? So at one level, if you just adapt everything and water everything down from the science, then you end up with nothing and you're not really doing anything anymore. The other side of that is that most of these evidence-based practices are not designed for the people that they're ending up we're often working with, right? So the samples weren't diverse. It was all done in English. The families didn't have weren't struggling with a variety of different issues. And so the evidence-based practice doesn't necessarily address the communities in which it's going to be built or going to be actually implemented. So you have to actually, the most important thing, and I think the biggest rule of thumb for me is to really work with the communities where this thing is going to be rolled out and get their feedback and engage them in the process. Not only the staff who are going to be rolling it out, but also people who are going to experience it or who have lived experience. We do a lot of work with what we call peers or family members who've had kids. I do mostly kids work. So family members who've had kids in the mental health system, and then who then go on and work with others. So I always want to talk to family peers about how they experience this practice and what they would change to make it more effective. And then I think you have to think about what are the core components, right? What are the things you can't change, and what are the things you can change? And let's change the things we can change to increase engagement, and also to think about the logistics of how this is going to work, right? So one of the things I know you mentioned you're going to be working in schools. One of the things you're going to learn when you start working in school is there's all sorts of stuff you have to do that has nothing to do with actually working with kids. And so when you implement an evidence-based practice, that's just another thing you have to do. And so one of the things I have a colleague, a mentor of mine, who talks about how if it's not easier or at least not any harder than what the person is doing now, then they're not going to do it. So how do we take this thing and make it be at least as easy as what they're going to be doing now? Like how do we integrate that into their electronic system? How do we make sure that they don't have to like print a bunch of stuff out before they have to talk to a family? Like are there extra toys they have to have? Like all this stuff. Like how do we make that as simple as possible? Because otherwise you just lose it.
Thank you so much for a really comprehensive answer. I appreciate that, and I loved hearing about like the collaboration with community members to kind of develop some sort of in a way like compromise between implementing the evidence-based practice within the community. And so, kind of thinking about like your leadership role, what pivotal decisions or moments led you from a PsyD to a leadership role at NYU?
So I'll just be very honest. This is not where I thought I was going to end up. So when I was, and if there's any undergrads on who are trying to figure out what to do with their grad school life, I'll give this advice, or not advice, but at least this comment. The one thing I was certain when I was a senior at Cal State Long Beach that I was not going to do was work in a university setting. It was the one thing I knew, which and is very ironic given the NYU background. So it was one thing I was certain I wasn't going to do because I wanted to do clinical work. I wanted to work with kids. I wanted to be a psychologist. I knew that. And I wasn't going to work in academia. And so I got a PsyD and not a PhD because at the time, basically, to get into a PhD program, you had to profess your love of research. I was certain I wasn't going to do any of that, and I wasn't going to work in academia, so I got a PsyD instead. Um, I'm really glad I got a PsyD, and I'm really glad I got a doctorate because it allowed for flexibility in the future. So I went and did all the different things clinically you can do with kids. I worked in residential settings, I worked in clinic settings, I worked in school settings, I worked in day treatment for kids settings. I worked in Head Start where I met my wife, which was fantastic. Not, and so because she was also a psychologist working at Head Start. So I worked at Head Start. I loved that job. I got chased around the yard by a bunch of 3 and 4 year olds. There was no more fun. Like that was the most fun I ever had in a job. Like, right, that was great. But what happened after a while is my last clinical job, which was in the early 2000s. I was working a day treatment program for kindergarten for kids K through 2. And I realized that I was going to be working with their kids in 15 years. And that just really broke my heart. And I was like, the system needs to change. And so I started looking for opportunities to change the system at a broader level, other than just working with each individual kid. And so my wife, who was also a psychologist, worked for a large nonprofit, and they were developing this program to translate evidence-based practices into real-world settings. And my wife was working on it, and I was like, if that ever becomes a job, I want that job. And so 6 months later, it became a job. And so, luck and life and all that stuff, I ended up with that job, and that led to me running with no idea what I was doing. Let's be very, very clear. I had no idea what I was doing. Running this nonprofit was just me and like paper clips. Running this nonprofit to implement evidence-based practices in the real world. And then eventually we moved that into NYU. But this broader systems work was definitely not what I thought I was going to be doing. But I will say that if I hadn't had the doctorate, that I probably wouldn't have gotten that job, and I definitely wouldn't be able to do what I do at NYU. So even though I didn't end up using all the doctorate later on for the clinical work so much, other than family therapy, which working with large systems, that comes in very handy. Just having it allowed me to have the flexibility to do a lot of different things. So that was kind of it was strategic to take that job, and then after that is just taking advantage of things as they come.
Mhm. Yeah, what a wealth of experience and getting to work with with kids one on one, and then kind of stepping up into like a more systems level change role. That's super interesting. And earlier you mentioned kind of undergrads and figuring things out and like what type of career they want to pursue. And it's always kind of like a mystery, and sometimes you might take risks in kind of pursuing one pathway. For those of like undergrads interested in the mental health sector, what kind of misconceptions do people have about working in the mental health sector? And then also kind of what are some like really cool or unique things about working in, or most rewarding things about working in mental health?
Yeah, so I think I'll start with the rewarding part. You get to work with people, and you get to help people. And if you're a person who wants to help people, there's no better way to help people than to work in mental health. It is an area of real need. And so that is incredibly rewarding. And I think that there are a lot of opportunities to do that. And I think that there's a lot of creative ways that you can work in mental health. And I think one of the things that's happened even just in the last 10 years, is first of all, the recognition of the importance of mental health has really changed. There is still a tremendous amount of stigma when it comes to mental health, but the level of stigma has been reduced. And so people are much more open talking about their mental health challenges than they were 10 years ago, certainly 30 years ago when I graduated. And so the opportunity to do different things has really opened up. I think the other thing is, some of the unexpected stuff is when I was in school, both undergrad, grad school, I really did think that the role for a mental health professional was simply to be a therapist. And that's what I wanted to do. So that was great. What I didn't appreciate was this whole other range of roles that you can do to still be a helper, to still help impact the system. So, I ended up in a role that at this point is, I hate to use the word administrative, but is largely administrative. But like I get to have a pretty large impact not only on, mental health agencies around New York State, but also impact on policy and what the state, Office of Mental Health decides they're going to do and roll out and how they're going to do that. And I never would have imagined that I would have been sitting in those rooms having those conversations. I think what a couple things, and this is not just mental health, this is a larger thing, but to just say out loud, a couple things to just realize is one of the things that you think when you're, until you end up in some of these weird rooms, is that there's a group of people somewhere who are making decisions who know what they're doing. And all of a sudden, you end up in a room with like senior policymakers at, let's say, the state level. And you realize that the group of people who are making those decisions are just a group of people sitting around a table going like, I don't know, what do you want to do? I don't know. I guess we should try this. And so get yourself into those rooms because there need to be more and more people in those rooms making those decisions. The other thing that I didn't realize at the time is the importance of money and billing and how all these things fit into health insurance and private pay and Medicaid and Medicare and all of those things. I never thought about any of that stuff. And I spend half of the training that we do is actually on helping providers manage their way through the finances of it all. And so thinking about that part of it is also really important. And if you want to change the system, changing how the funding of it works also is just as important as working with the people in the system. And it doesn't mean that you're not helping. It's just helping in a different way.
Yes, thank you so much for that. Yeah, that's definitely a lot to think about, in a good way. Kind of speaking about, I guess you kind of touched on it earlier, but I was curious to know what changes do you anticipate in mental and behavioral health policy over the next decade, or what are some like already exciting like developments being seen in schools or clinics or even hospitals? Anything that's kind of that makes you excited to really talk about?
Yeah, that's a wonderful question. So I think this medium, being able to do the pandemic was awful. But one of the things that it really did was open up the capacity of telehealth and the ability to have therapy online. And so I know we've all heard of Better Health and all that other kind of stuff. So obviously that's out there. But the ability to see people online is drastically increasing access into the system. It also, for those of you who are looking to be therapists, increases your job opportunities and gives you leverage in terms of your first job out of college or out of grad school, that you didn't necessarily have before telehealth. So it's a good thing financially for you. And it's also a good thing for people because you can access services. I think the traditional kind of what we have in our mind of like you're going to go and meet with somebody for a year and you're going to process all your problems and do all that stuff, the kind of traditional therapy is always still going to exist. But I think being able to do therapy in briefer episodes to say, hey, I'm struggling with this thing. I want to go talk to somebody for a couple sessions and deal with that. I think that part of it's going to change a lot. I also think just having broad mental health in a broader sense, having access to non-traditional services, so it's not therapy so much. So I know you're going into school psych, right? The ability to work with a teacher in a classroom to maybe help a kid. They don't necessarily need therapy, but they need to help like how do we help this little kid in this classroom stay in their seat for the 60 minutes of the session, right? Like what are the strategies? Like non-traditional using mental health in order to address non-traditional kind of things outside of that that more traditional therapy thing. Um, I'm trying to think of some other things that I see coming down the pike. I do think how we pay for service is going to change a lot. I think we'll be paid. I think mental health is increasing in value going forward, so I think there's a real opportunity there as well.
Thank you so much for those insights. Kind of speaking to earlier, I thank you for your honesty of you kind of stepping into like a more leadership role and kind of maybe being a little bit overwhelmed by like responsibility or just working with new systems. Kind of thinking about your leadership qualities. What leadership qualities are essential in complex healthcare systems?
So there's only 10 people in the world. And we think of the world as being big, but in any system you get into, there's only 10 people. I say there's only 10 people. Obviously, there's more, but there's only 10 people and they all know each other. And so all of this is based on relationships. And so part of leadership is building good relationships with the people that you're going to work with, both the people who work with you, the people you work for, the people who work for you, um, but also the relationships with your funders and the relationships with other community members. And so everything I have certainly done in the last 25 years since I kind of transitioned out of clinical work has been based on relationships. And also, and I'm not sure if this is on the list or not, but also find mentors. Find people who have been doing this for a while, who can give you good advice, and who you can close the door and just be like, what are we doing here? Because we're all imposters. We're all trying to figure this out as we go. No one has all the answers. And so finding people who have roles that could be helpful in helping you figure that out, I think are really important. Um, and also, and this is just my leadership approach, and other people have other approaches. The vast majority of people who work with you are trying to do their best. And so when people mess up, coming from a teaching standpoint, I think is really, really important, and helping people do a better job because most of us are just trying to do the best we can most of the time. And I would also argue, and I think it's important, is being able to give people the flexibility they need to be able to live their lives. Our lives are really complicated. People have kids, they have parents, they have relationships, they have all that stuff. And people are always appreciative when you can let them have the flexibility they need to kind of live their lives. I think that's really an important part of it too.
Thank you for that answer. And to kind of move on, it's 2026, and it wouldn't really be a conversation if we didn't mention artificial intelligence and its
Yeah.
role and impact on in society. So, with AI transforming the way some industries are being operated, what role does technology play in your work with scaling mental health interventions?
So I'm so glad you asked that because it was on my mind when I was thinking about the things that are going to change, and I didn't mention AI, so I'm glad you brought it up. So I think that AI is going to drastically change, and we're starting to think about doing some of this work, how you get trained in mental health. So I learned to do therapy by working with real people, which I wouldn't necessarily recommend, right? Like, you go out, you work with real people, and you learn, how to do this with real people. I think the opportunity to use simulations to train students, to train staff, to learn new practices is huge. And I think AI can enable that in a cost-effective way, in a way that we haven't been able to do that before. And I think 5, 10 years from now, the way we train students is going to be drastically different. And I think you're going to practice on pretend kids long before you work with actual kids, which I think is a great thing. Will it be perfect? Absolutely not. But will it be incredibly helpful to build your competence as a new clinician? Yes. Um, I think whether AI is going to be the therapist, I think is a mixed bag, and I don't know. I think AI can be helpful in will probably be helpful in helping with some very minimal things. I don't think you can have AI as a therapist replace the complexity of a human being as a therapist. And I think we've seen that in all the ways that AI is screwed up, and I don't need to go through all that. AI is helping me do my job now a lot. Um, it's able to short circuit things and we're able to do things quicker. And, I had to create a database of evidence-based practices, and that would have taken a bunch of people, 6 months of their lives, and we were able to do it, in an afternoon using AI. So that's great. But I think in our field, the biggest way it's going to help is with training. I also think it's already helping with things like documentation. So for those of you who are going to be out there doing clinical work, the bane of your existence is going to be writing case notes. They take forever. They're just hard. So a lot of the electronic health records now have ambient listening listen in. They like literally listen to the session and it writes your note for you, and all you have to do is proof it. That's huge. Like I'm all for that, right? You still have to read it because AI, isn't perfect, but it's great. So I'm a huge fan of those kinds of things. I think it's going to help on the evidence-based practice thing in terms of guiding you through what you can do with people who have particular diagnoses. But will it replace all therapists? No, I think we're still good. Just like we're going to need teachers and we're going to need, whatever. I think we're still going to need people doing the real work in the real world. And people are infinitely complex and computers can't figure all of that out.
Thank you for that answer. And yeah, so Andy, it sounds like you're doing, there's a lot on your plate and there's a lot of like responsibility that comes with the job. And so, how do you maintain that work-life balance, in a high impact leadership role? And you being in New York, like, is there some of like favorite things you like to do to kind of decompress from work, whether that be like visiting Central Park, or how do you kind of like, escape it, but also at the same time, be committed to the work that you do?
Yeah, so it's a really good question. Having important relationships outside of work is really important. So I have a really cool family. I have two kids in college. I have a wife, and so that's really important. I live in New York. This applies in LA as well. Food is wonderful. I love food. I'm a cook, so I cook. I do all of that. So that's like my hobby is I cook, I grill, I do all those kinds of things. I take advantage of all the things you get to do in New York. I eat well. You do the theater. I'm a huge sports fan, so we do all the sports. Yankees. So I grew up in LA, a Dodgers fan, but I do root for the Yankees a lot. So I go to a lot of Yankees games. We do a lot of that kind of stuff, and you have to take advantage of the things that are out there. I do think I want to hit the mentor point again too. I think this industry, particularly if you're doing direct clinical practice, is really you can get burnt out. And I think having mentors and having a support system that's there for you is really important. And also having boundaries and putting down the phone. I will say that one of the things that helps me is having done in clinical work and done intensive clinical work with really high need populations. I recognize that in my job, like you know, the worst thing that's going to happen is we send out the wrong email and we have to deal with that. But like, no one's life is at risk in the work that I do now, and there's a piece in that. And for those of you who are in that other side of it, I think really having a strong support system outside of work and then having boundaries, and you have to leave it there. You just have to leave work in the office and not take it home. And if you get to the point where you need a slightly less stressful environment, then you transition into something like this. We have a lot of people, most of the people who work and do the work that I do started out as clinicians, which gives them credibility in the work that we do, and also allows them to give back, but not have to do that kind of level of intensity all the time anymore either.
Awesome. And we do have a question that's from the chat. So Andy, how do you collaborate with professionals outside of psychology? So kind of thinking about people from the public health sector, or maybe people from technology.
That's a super, super good question. So I really appreciate that. So one of the things that especially if you work in systems, so if you work in private practice, you can kind of just do your private practice with clients and you'll probably collaborate with some psychiatrists, et cetera. But you can kind of do that. But if you work in public systems like I do, you collaborate with everybody. So you have to work with nonprofits. You have to work with housing. Housing's super, super, super important. Like housing, if you have to pick one thing, housing's it, right? Like housing is the most foundational of everything. So you have to work with nonprofits, you have to work with housing, you have to work with the hospital system, you have to work with the medical system, integrated care. So if people have issues, with healthcare, they have issues with mental health, the rates of physical health challenges among people who have mental health issues is exponentially higher. You have to work with the substance use system. You also have to work with public safety. So you have to work with the police. You have to work with all of those different groups. So I think it's really important to build strong relationships, to recognize what you bring to the table and recognize what they bring to the table and find opportunities where if by working together you both win. So, the opportunity, healthcare and healthcare professionals, they want to make sure that if they make a referral to mental health, that person's going to get better and that you're going to deal with it. And if you make that referral to healthcare, they want to make sure. So, like building those relationships where you can really kind of collaborate across those systems, I think is really important.
Mhm. Thank you so much for that, Andy. And then kind of thinking about taking, like reflecting on your graduate education. For those of you, for those in the audience that might want to pursue these high leadership roles, how important is graduate education for entering your field? Like, could you do the same work without a PsyD and maybe a master's degree? Or do you think you can take a leadership role just with a bachelor's degree in psychology or in areas of mental health?
So I think in mental health, I think a master's degree is kind of the entry level, right? Because you can't officially be a clinician without a master's degree. You should work. You should go out and do lots of things. You can do stuff in the field of mental health, but if you want to work in the mental health system, you kind of need a master's degree. So that's kind of an entry level. You don't need a doctorate uh, to do that work. You don't. You can get a master's degree in psychology. You can get a master's, MFT, various masters in counseling, school psychology. You can get a social work degree. You can do all those things. If you want to be a clinician, that's a good entry point. Um, as you go into leadership, you don't need a doctorate. You really don't. The benefit of getting a doctorate at some point is it allows you flexibility. It allows you to do a variety of different things and be in a variety of different rooms that you're not able to be at. So I'll use a university as an example. So at NYU, and this applies in most universities, in order to truly be in charge of a grant, what they call a principal investigator, you need to have a doctorate, period. That's just the rule. You can't be in charge unless you have a doctorate. You can work, you can do all sorts of things, you can do amazing stuff, but you can't technically be in charge of the grant unless you have a doctorate. So there you go. If you enter into medical systems, having a doctorate matters a lot. But if you want to be a clinician and work with kids or work in a school or whatever, get your master's degree. Go do the work. If you decide that at some point you need a doctorate, go get one. A little hack for people, which I did not know, and I did achieve my goals of paying off my grad school student loans before my kids went to college, but it was close. A hack that if you want to go back and get a master's degree, get a doctorate, many universities, if you're on staff, you get to go for free. And so I can't tell you the number of people in my office who've gotten another master's degree or gotten their doctorate. We have 3 people getting their doctorates in various things this semester. And none of them are taking on any student loans for that. So that is a hack that if you find a university where you want to get your degree, go get a job there, work there for a year, and then you can get your degree for free a lot of times. It is a big, 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 big benefit.
Wow, that thank you for saying that. That sounds super helpful and yeah, like a pretty like unique opportunity to kind of get that type of support and assistance from the university workplace. I think is really cool.
Yeah.
And so kind of similar to what you just talked about, kind of looking back, would you do anything differently as a student preparing for your current career? Maybe kind of thinking about like taking on like an extra credential maybe, or maybe not pursuing something.
Yeah. So, and I say this as a parent of 2 kids who are just wrapping up their sophomore years in college. So I come at this from both sides. So I'm saying it like thinking back, but I'm also saying it like watching this play out in real life. First of all, nobody has any idea what they're going to be doing 30 years from now. Like nobody. So, and the one thing that you do that didn't go well is not going to define your life. So I think to take risks now is like really important and say yes. If you get an opportunity to do something, just say yes. Just do it. If you don't like it, that's great. That's knowledge. You'll learn. Like if you like get an opportunity to work with kids for the summer and it turns out you hate kids, then like now you know you don't want to work with kids, right? Like it's really good. Do as many things as possible, experience as many things as possible. This period of life is short. you don't appreciate it at the time, but it's like super, super short. And it has a huge impact on where you end up, but also like it's not a straight line. Like there's all these little forks in the road that you don't know about at the time, and you're going to make a decision, and the whole world doesn't rely on that. So looking back, like give yourself some grace. You're going to mess up. You're going to change your mind 7 times. That's all good, like totally fine. And it'll all like kind of work out in the end, and you'll like sort it out. Um, I think the power of just getting as many experiences as possible. Talk to those career advisors in college. Like that's really important. Take their advice, don't take their advice, but at least listen to it. Do as many things as you possibly can. I think that's like super, super important. There was one other thing in there, and I forgot what it was that I was going to say. But just embrace. Oh, the other thing, and this is something you don't appreciate um, until you're older, and I'm sounding old, but you don't, when you're at this particular stage in your life, in your career, oftentimes you don't have as many responsibilities. Some people may, and that's totally understandable. But if you don't have 2 kids and you don't have to pay like a mortgage and you don't have like those responsibilities that you can't get away for, it's a great opportunity to take lots of risks because as you get older and have all of those things, you can't take those risks anymore because you have to make sure that certain things are done. Now is the time to move across the country. Now is the time to like quit your job and go do something totally different. To like, like now is the time to do that. So take advantage of those things now. And if you hate something, do something different. You're not locked in. Like the number of people I know who were like, I was going to be a lawyer and I got to law school for the first semester and realized that was awful and I didn't want to do that. Now I do something else. Like just do that. Like take as many opportunities as you can now because as you get older, you just can't. You can't do that as much because you have responsibilities and people who rely on you. So take advantage of that.
Mhm. Wow. Thank you so much, and that's super helpful. And really quick, I know we have about less than 3 minutes left, but thank you so much for that advice. But for those that have been hearing you today and like really resonate with the work that you do you have any specific advice for them in making a career in this industry?
Yeah, I think this, if especially if you do direct practice, it's hard. So find a place that you want to be and work there. And if you're going to do clinical work, figure out what population you like. If you like to work with old people or, the elderly, if you like to work with the elderly, work with the elderly. If you like to work with kids, work with kids. Figure out what you want to do and make that contribution. I think that contribution is like super important, but also don't be afraid to change. These careers evolve over time. Some people find their passion and they do the thing that they do forever, but most of us don't. Most of us do a variety of different things over the course of our careers. And so these decisions are super important, but they're not the only decision you're ever going to make. So make those decisions and be flexible about how you make them. And give yourself the opportunity to change your mind over time. I think that's really important and something you just don't appreciate when the weight of like every decision seems to be huge.
Thank you for that. And it looks like we don't have any more questions. Thank you so much, Dr. Cleek, for joining us today. And for those of you still in the audience, once again, please visit the alumni website in the weeks ahead to see this and other recordings, as well as a schedule of upcoming virtual events. Lastly, make sure to follow us on LinkedIn. Thank you so much for attending and go Beach.
All right. Thank you so much for having me. It was really a pleasure to be on today.